Good afternoon, everyone. This is Christine at Health Current. Thank you again for joining us for today's Objective 7 Health Information Exchange webinar. Again, the presentation is provided through a shared commitment between Access, ADHS, Health Current, and Myers and Stofers to increase participation in the Medicaid Promoting Interoperability PI program. Just a few logistic reminders. Today's webinar will be recorded and posted to the Health Current and Access websites. We encourage you to use the chat box for questions and comments. Just a reminder to not include any PHI information. We are going to be muting all lines. And Connie, if you are with us, I'm going to turn it over to you to introduce our presenter.
Thank you, Christine. Can you hear me?
I certainly can.
Perfect. We are pleased and delighted today to have Priscilla Clark as Senior Accountant with Myers and Stouffer, a certified public accounting firm that specializes in federal and state Medicare and Medicaid programs, as our webinar presenter today. So with no further ado, Priscilla, you may begin your presentation.
Thank you, Connie. Appreciate it. Today's webinar, we will be discussing the Health Information Exchange objectives. So here are just some learning objectives for everyone that we will learn during today's webinar. The first one is to understand the Health Information Exchange requirements for the Medicaid Promoting Interoperability Program. The second is to understand the differences in Objective 7 Health Information Exchange between program year 2018 and 2019. And then the last learning objective is to learn about the Health Information Exchange documentation requirements. So the objective is that the eligible professional, otherwise known as EP, provides a summary of care record when transitioning or referring their patient to another setting of care, receives or retrieves a summary of care record upon the receipt of a transition or referral or upon the first patient encounter with a new patient, and incorporates summary of care information from other providers into their electronic health record using the functions of a certified electronic health record technology. An EEP must attest to all three measures and meet the minimum threshold for two of the three measures. An EP must meet the minimum threshold for two of the three measures. We're going to go through a couple examples. If the EP meets the criteria for exclusion from two measures, they must meet the threshold for the one remaining measure. Another example is if the EP meets the criteria for exclusion from all three measures, they may be excluded from meeting this objective. Some examples of possible combinations are included below. For the first example, it's a pass. It shows that under measure 1 and 2, they're meeting the minimum threshold, and then under measure 3, they do not meet the threshold or exclusion. So it shows that they meet two of the measures, so they don't have to meet that third measure or the exclusion for that third measure. The second example is also passing. It shows that EP meets the threshold for measure 1, but then for measure 2 and 3, the EP meets the exclusion, and that EP would be passing the requirements for this objective. The third example is also passing. It shows that the EP meets the exclusion for all three measures. Okay, and then the last two examples we're going to go over shows how an EP could fail this objective. So for that first failing one, it shows that the EP meets the threshold for measure 1, meets the exclusion for measure 2, which means that EP must either meet the threshold or the exclusion for measure 3. However, it shows here for this example that the EP does not meet the threshold or the exclusion, so the EP is failing. For the last example also shows the EP is failing. It shows EP meets the exclusions for measure 1 and 2, which means that EP must either exclude from the third measure or meet the minimum threshold. However, in this scenario, the EP does not meet the threshold or exclusion, which means the EP would fail to meet the requirements of this program. We're going to go through some definition of terms that we will be using regularly throughout this webinar. For current problem list, it means at a minimum a list of current and active diagnoses. For active and current medication lists, we will be talking about a list of medications that a given patient is currently taking. For the active current medication allergy list, it's referring to a list of medications to which a given patient has known allergies. When we say allergy, we mean an exaggerated immune response or reaction to substances that are generally not harmful. For care plan, we're referring to the structure used to define the management actions for the various conditions, problems, or issues. A care plan must include at a minimum the following components. It must include goals, health concerns, assessment, and a plan of treatment. When we talk about exclusions, CMS allows some exceptions for EPs to admit from reporting on a measure. Exclusions vary depending on the measure. An EP must still submit documentation to support qualifying for the applicable exclusion. Okay. Another definition is a transition of care. It is the movement of a patient from one setting of care, hospital, ambulatory, or primary care practice, specialty care practice, long-term care, home health, and rehabilitation facilities. So you're transitioning that patient from one setting of care to another, and those are just some examples of the different types of settings of care that EPs could be doing. At a minimum, this includes all transitions of care and referrals that are ordered by the EP. The transition of care must take place between providers which have at a minimum different billing identities within the Medicaid PI program, such as different national provider identifiers, otherwise known as NPIs, or hospital CMS certification numbers to count towards this objective. If the receiving provider already has access to the cert of the initiating provider of the transition or referral, simply accessing the patient's health information does not count towards meeting the numerator of this objective. However, if the initiating provider also creates and sends a summary of care document, this transition can be included in the denominator and the numerator as long as that transition is counted consistently across the organization. So you make sure that numerator and denominator are being counted consistently. Referrals are cases where one provider refers a patient to another provider, but the referring provider also continues to provide care to the patient. So that initiating doctor still takes care of the patient, but they brought in another doctor to help out with a different potential disease or healthcare concern. So let's go over what summary of care record is talking about. This applies to measures 1 and 2 only. So all summary of care documents used to meet this objective must include the following information if the provider knows it. It needs to include the patient name, the demographic information, the smoking status. These next 3 items we're going to talk about are in bold and they are required no matter what. Okay, so we'll get into some further detail about that throughout the presentation. So that current problem list is when providers may also include, they can include historical problems at their discretion inside that current problem list. They must provide the current medication list, and they must include the current medication allergy list in that summary of care record. Some other items are laboratory tests, the laboratory value or results, the vital signs such as height, weight, blood pressure, body mass index. It must include procedures in the summary of care record, care team members that are potentially helping out. Keep in mind that those 3 bold items must be in the summary of care record. An EP must verify that the required fields for current problem list, current medication list, and current medication allergy list are not blank and include the most recent information known by the EP as of the time of generating the summary of care document. Or you can include a notation that there is no current problem or current medication or current medication allergy list in that summary of care record, but you can't leave it blank. You need to identify what those lists are, like provide lists, or say, hey, there is no list. Okay, some other things that should be included in the summary of care record is immunizations, unique device identifiers for a patient's implantable device, care plan, including goals, health concerns, and assessment and plan of treatment, the referring or transitioning provider's name and office contact information, the encounter diagnoses, the functional status, including activities of daily living, cognitive and disability status, and then the reason for referral. Apart from the 3 fields noted on the previous slide as required for the summary of care records, which was the current problem list, current medication list, and current medication allergy list, in circumstances where there is no information available to populate one or more of the fields listed, the EP may leave the field blank. And still meet the objective and associated measure. But keep in mind those 3 items bolded and in red that says required in that previous slide are required. Some examples of when this might occur is because the EP does not record such information or because there is no information to record. But just keep in mind those 3 items are the exception to this. An EP must have the ability to transmit all data pertaining to laboratory test results in a summary of care document, but may work with their system developer to establish clinically relevant parameters for the most appropriate results for the given transition or referral. An EP who limits the transmission of laboratory test results data in a summary of care document must send the full results upon request, so all lab results as opposed to a subset. The exchange must comply with the privacy and security protocols for electronic protected health information under the Health Insurance Portability and Accountability Act, otherwise known as HIPAA. In cases where the providers share access to an EHR, a transition or referral may still count towards the measure if the referring provider creates the summary of care document using CERT and sends the summary of care document electronically. If an EP chooses to include such transition to providers where access to the EHR is shared, they must do so universally for all patient and all transitions per referral. And that's just to keep those calculations consistent. While an EP CERT must be capable of sending the full consolidated clinical document architecture, and we will refer to that as the CCDA throughout this presentation, summary of care, and an EP must do so upon request. An EP may use any document template within the CCDA HL7 standard for purposes of meeting the health information exchange measures. So let's just discuss Objective 7, Measure 1. Measure 1 is that for more than 50% of transitions of care and referrals, the EP that transitions or refers a patient to another setting of care or provider of care, they 1, create a summary of care record using CERT, and 2, they electronically exchange the summary of care record. In order to count a transition of care or referral in the numerator, the action must occur within the calendar year in the PI reporting period that occurs. The referring EP must have reasonable certainty of receipt by the receiving provider to count the action towards the measure. An EP must have a confirmation of receipt or that a query of the summary of care record has occurred in order to count the action in the numerator. The initiating EP must send a CCDA document that the receiving provider will be capable of electronically incorporating as a CCDA on the receiving end. In other words, if an EP sends a CCDA and the receiving provider converts the CCDA into a PDF or a fax or some other format, the sending EP may still count the transition or referral in the numerator. However, if the sending provider converts the file to a format the receiving provider could not electronically receive and incorporate as a CCDA, the initiating EP, that first EP, may not count the transition in the numerator. So some changes from modified stage 2 to stage 3 is in President of 2018, it was called Objective 5, and then in 2019, it's called Objective 7, Measure 1. The stage, of course, changed from modified stage 2 to stage 3, which is a requirement for program year in 2019. And then the percentage, it was greater than 10% in program year 2018, but now in 2019, it is greater than 50%. So what are the documentation requirements for Measure 1? It should be a CERT-generated dashboard for the selected PI reporting period that shows the following 4 items: the provider's name, the numerator, the denominator, and the measure percentage. Keep in mind, in certain situations, a non-CERT-generated report may be necessary. The use of the non-CERT-generated report may be permitted upon access review and approval. Objective 7, Measure 2. This is for that, the requirement is that for more than 40% of transitions or referrals received in patient encounters in which the EP has never before encountered the patient, he or she incorporates into the patient's EHR electronic summary of care document. So now we're not going to be initiating the transfer, but we're going to be receiving that transfer for the patient. CMS does not define the word incorporate for this measure, as it may vary among recipient providers based on the provider's HIE workflows, their patient population, and based on the referring provider. The record may be included as an attachment as a link within the EHR or as imported structured data, or the provider may conduct a reconciliation of the clinical information within the record to incorporate this information into the patient record within the EHR. A record cannot be considered incorporated if it is discarded without the reconciliation of clinical information, or if it is stored in a manner that is not accessible for the EP use within the EHR. There may be circumstances when a patient refers himself or herself to a setting of care without the provider's prior knowledge or intervention. These referrals may be included as a subset of the existing referral framework, and they are an important part of the care coordination loop for which summary of care record exchange is integral. An EP should include these instances in their denominator for the measure if the patient subsequently identifies the provider from whom they received care. An EP may count such a referral in the numerator for the measure if they undertake the action required to meet the measure upon disclosure and identification of the provider from whom the patient received care. Keep in mind that even though this information is detailed under Objective of Measure 2, it can also potentially, if applicable, be applied to Measure 3, numerator and or the denominator. For purposes of defining the cases in the denominator for Measure 2, CMS stated that what constitutes unavailable and therefore may be excluded from the denominator will be that an EP, 1, requested an electronic summary of care record to be sent and did not receive electronic summary of care document, and the EP does one of the following 2 items. They queried at least one external source via the HIE functionality and did not locate a summary of care for the patient, or the provider does not have access to HIE functionality to support such a query. Or the second option, which would be confirm that HIE functionality supporting query for summary of care documents was not operational in the provider's geographic region and not available within the EP's EHR network as of the start of the PI reporting period. So keep in mind there's 2 things that EP needs to meet. There's that the second bullet point talking about requesting electronic summary of care record, and then those last 2 bullet points, the EP has to meet one of those requirements for them to be able to exclude patients from the denominator. Okay, so changes from modified stage 2 to stage 3 when talking about measure 2. In program year 2018, this measure did not exist. So this is a new measure for program year 2019. The documentation requirements for Measure 2, they're similar to Measure 1. It needs to be a CERT-generated dashboard for the selected PI reporting period that shows the following 4 items: the provider's name, the numerator, the denominator, and the measure percentage. Now keep in mind that provider's name, the CERT dashboard needs to be for that specific provider, not for the entire practice. That numerator and denominator that's showing on that CERT-generated dashboard is specifically related to that provider. And this applies for all 3 measures underneath Objective 7. In certain situations, a non-CERT generated report may be necessary. The use of non-CERT generated reports may be permitted upon access review and approval. Moving on to Measure 3. The requirement is that for more than 80% of transitions or referrals received and patient encounters in which the EP has never before encountered the patient, he or she performs a clinical information reconciliation. The EP must implement clinical information reconciliation for the following 3 clinical information sets: the medication, which is a review of the patient's medication, including the name, dosage, frequency, and route of each medication. The medication allergy is the second item. It needs to review of the patient's known medication allergies. And then the third item is the current problem list, which means the EP needs to review the patient's current and active diagnoses. The process may include both automated and manual reconciliation to allow the receiving EP to work with both electronic data provided within the necessary review and to work directly with the patient to reconcile their health information. If no update is necessary, the process of reconciliation may consist of simply verifying that fact or reviewing a record received on referral and determining that such information is merely duplicative of existing information in the patient record. Non-medical staff may conduct reconciliation under the direction of the EP so long as the EP or other credentialed medical staff is responsible and accountable for review of the information and for the assessment of and action on any relevant clinical decision support alert. There may be circumstances when a patient refers himself or herself to a setting of care without a provider's prior knowledge or intervention. An EP can include the patient in the numerator or denominator if all actions are met. We did discuss this earlier underneath measure 2, so you can look at slide 20 for more information, just to review and see if it applies for measure 3 for the numerator and or the denominator. So what were the changes from modified stage 2 to stage 3 for measure 3? So in program year 2018, it was just objective 7. There was not multiple measures underneath that objective. And then it was also called modified, it was in modified stage 2. Now in program year 2019, it's objective 7, measure 3. And then we're working in stage 3 for this. The threshold in program year 2018 was greater than 50%, and then CMS increased that in program year 2019 to greater than 80%. The medication allergy item was not required in program year 2018, but a review of the patient's no medication allergies are required in program year 2019. The current problemless reconciliation was also not required in program year 2018, but a review of the patient's current and active diagnoses is required in program year 2019. So what are the documentation requirements for meeting measure 3 that needs to be submitted during attestation? It needs to be a CERT-generated dashboard for the selected PI reporting period that shows the following 4 items: the provider's name, the numerator, the denominator, and the measure percentage. So just make sure all 4 of those things are showing. Keep in mind that in certain situations, a non-CERT-generated report may be necessary, and the use of non-CERT-generated reports may be permitted upon access review and approval. So let's look at objective 7 exclusions for all 3 different measures. When we're talking about exclusions, the EP is not required to submit data or meet the measure. However, the EP must submit documentation of how he or she meets the exclusions that are claimed. There's 3 different types of exclusions for objective 7. We call them the number of patient transfers criteria, the broadband criteria, and the 3rd exclusion, the number of patient transitions and referrals criteria. An EP may take an exclusion if the EP meets the exclusion criteria applicable to the measure in the table below. As you can see to the far left, it talks about which applicable measure the exclusion applies to. In the far right, it explains that exclusion. So for measure 1, if an EP transfers a patient to another setting or refers a patient to another provider fewer than 100 times during the PI reporting period, they can take that exclusion for measure 1. And your CERT-generated dashboard most likely will show less than 100 in that denominator. For measures 1 and 2, an EP who conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 4 megabytes per second broadband availability, according to the latest information available from the FCC on the first day of the PI reporting period. EPs in the state of Arizona are not able to meet this exclusion because they have greater than 4 megabytes per second broadband availability throughout the entire state. Then for measures 2 and 3, so we're on that bottom row, talking about the last exclusion, it's the total transitions or referrals received in patient encounters in which the EP has never before encountered the patient is fewer than 100 during the PI reporting period. So if the EP meets that exclusion, they can take the exclusions for 2 and 3. So just keep in mind to look at that, the EP CERT-generated dashboard. Okay, for the broadband access exclusion, we're just going to talk about this for a little bit just to make sure you'll understand why the EPs in the state of Arizona are not able to meet that exclusion. For program years 2015 through 2017, CMS identified the counties in the U.S. who conducted 50% or more patient encounters in a county where 50% or more of its housing units do not have 4 megabytes per second broadband availability and therefore meet the broadband exclusion. However, the state of Arizona did not have any counties listed on that document, and therefore the EPs in the state of Arizona are not able to claim this exclusion. CMS has not published an updated list of the counties. However, the majority of counties in the U.S. have increased their broadband availability and still do not meet the requirements for the exclusion. It is unlikely that broadband availability would have decreased since the CMS tip sheet was published. And then there's a link at the very bottom that talks about the CMS Broadband Access Exclusion. So that's that document that CMS created for program years 2015 through 2017. The exclusion documentation required. So if an EP claims an exclusion, what type of documentation must the EP submit during attestation? Measure 1 only is that requirement that the EP transfers a patient to another setting or refers a patient to another provider fewer than 100 times during the PI reporting period. For measures 2 and 3, we talked about how if the EP's total transitions or referrals received in patient encounters in which the EP has never before encountered a patient fewer than 100 during their PI reporting period, the EP can meet the exclusion for measures 2 and 3. The documentation for both of those exclusions is to support that is that the EP must submit either, there's 2 different options. The first one is the CERT dashboard showing if the EP had fewer than 100 qualifying transitions, referrals, or encounters for the appropriate measure during that PI reporting period. So you want to look at that CERT generated dashboard and see what numbers are in the denominator for that specific EP during the PI reporting period. The second option that they can allow is providing support documentation other than the CERT dashboard that demonstrates the EP had fewer than 100 qualifying transitions, referrals, encounters for the appropriate measure. The broadband access exclusion for measures 1 and 2, Arizona EPs are unable to meet this exclusion per CMS, and then we also have that link again on this slide. So let's discuss the audit findings. So what happens during an audit? So all providers that receive a Medicaid PI program incentive payment could potentially be selected by Access for post-payment audit. If selected, Access post-payment audit, Access post-payment analyst will conduct a thorough review of the documentation attached to the EP's attestation and EPIP to determine if it meets the program requirements. Access may have follow-up questions or make additional documentation requests. The CERT dashboard does not show the PI reporting period or the EP name. These are some common audit findings that we've seen throughout. Also is failure to maintain documentation and the practice no longer has access to the CERT. The third item is including data for the entire practice in the CERT dashboard report rather than data for the individual EP. And we did discuss on a few slides earlier how that sometimes there are issues with that, where a practice may submit the numerator and denominator for the entire practice during the PI reporting period. So there are certain times where that occurs. So just make sure you're submitting it for the specific EP. Okay. The other option is not uploading the CERT dashboard during attestation. Here are some resources. So the CMS Objective 7 tip sheet is listed there, the federal final rule, and you can click on these links. So this presentation will be made accessible on the Access and Health Current websites. So you can look at these different links and click on them. The CMS Broadband Access Exclusion is also there, and then the Access Health Information Exchange Frequently Asked Questions document is there. And we'll take some questions in a few minutes, so make sure to use the chat box for that. But if there are no questions, we can pull up that document and go through some of those questions that we've come up with on our end just to try to help y'all, get y'all thinking of what kind of questions or issues y'all might run into during attestation. Okay. Here are some contact information. So we have listed the Access PI program, and then also the Health Current. So if you want to send any questions to that email or the phone number, feel free to reach out to those people after this presentation is over, and they'll answer those questions for you. Okay, So now we're going to take some time to take some questions. Connie, Christine.
Priscilla, I'm not seeing any questions in the chat box, although I understand there were some folks that were having some difficulty hearing you throughout today's presentation. So I'm not sure if you're able to come closer to your phone or mic, or if there were specific areas that folks didn't hear fully that they would like you to go back and talk a little further about. Again, I'll open that up in the chat box for folks. But at this time, I'm not seeing any additional questions come through.
Okay, perfect. Sorry about that. So if anyone does have any areas or slides they want me to go over again, I can absolutely do that. And we'll give you all a few minutes to do that. In the meantime, I'll bring up the frequently asked questions document, and so we can discuss those items. Just go through some of these questions. And if y'all do have any questions, feel free to put them in the chat box, and I'll stop going through this document to answer the questions that y'all have during this call. Okay, so for the first question is, how does an eligible professional meet the health information exchange objectives? An EP must meet the minimum threshold for 2 of the 3 measures or meet the available exclusion. If the EP meets the criteria for exclusion from 2 measures, they must meet the threshold for the 1 remaining measure. And then if EP meets the criteria for exclusion from all 3 measures, they may be excluded from meeting this objective. Some examples of possible combinations are included below. These were discussed at the very beginning of the presentation, but again, and I'm going to highlight these. So that first example is showing an EP as passing. So for measure 1 and 2, it shows the EP meets the threshold. And then for measure 3, it shows they do not meet the threshold or exclusion, but that EP is still passing. The second example is on that second row, and it talks about the EP meeting the threshold for measure 1 and then the exclusions for measures 2 and 3. So keep in mind, they claim the exclusion for one of the measures, they have to meet or claim the exclusion for the other 2 measures. For the third example, it shows that the EP meets the exclusion for all 3, and that is sufficient as well. The first failing example, it shows that the EP meets the threshold for measure 1. It meets the exclusion for measure 2, which means they need to meet the exclusion or the threshold for measure 3, and that shows that in this example, the EP did not meet the threshold or the exclusion, so therefore they're failing. The last example shows that the EP is failing, and it shows that the EP claimed the exclusion for measure 1 and 2, but for measure 3, they did not meet the threshold or exclusion, and therefore are failing, because if they claim the exclusion for 2 measures, they need to claim that exclusion or meet the minimum threshold for measure 3. And Christine, can you hear me okay right now?
I can hear you. The sound does sound a little garbled for me, but I'm not hearing any issues overall.
Okay, perfect. Just let me know and interrupt me if you can't hear me if I start to go out.
Okay, thank you.
Thank you, Christine. I'll keep going through some of these questions. I'm going to skip the next couple because they're just talking about the definitions for the different verbiage and language that we use throughout this presentation. So if we go to question 9, the question is an EP able to transition a patient to himself or herself at another practice location to meet objective 7? The answer is no. The transition of care must take place between providers which have, at a minimum, a different billing identity within the Medicaid PI program, such as a different NPI or hospital CMS certification number, to count towards this objective. For objective 10, is an EP able to transition a patient to another EP using the same cert to meet objective 7? The answer is yes, if the receiving provider already has access to the cert of the initiating provider of the transition or referral, and the initiating provider also creates and sends a summary care document, this transition can be included in the denominator and the numerator, as long as this transition is counted consistently across the organization. So make sure that numerator and denominator are consistent. The summary of care document must be created and sent electronically using CERT. If the receiving provider already has access to the CERT of the initiating provider of the transition or referral, simply accessing the patient's PHI does not count towards meeting the numerator of this objective. For question 11, it talks about what information must be included in the summary of care record to meet measures 1 and 2. The answer is that all summary of care documents used to meet measures 1 and 2 must include the following information if the provider knows it. So we went through this list earlier. It talks about patient name, demographic information, smoking status, and then there's those 3 bold items which are required: the current problem list, the current medication list, and the current medication allergy list. Going on down the list, it talks about you identify the laboratory test, the laboratory value and results, the vital signs, the procedures, the care team members who are assisting with that patient, the immunization, the unique device identifiers for a patient's implantable device, the care plan, including goals, health concerns, and assessment and health and plan of treatment, referring or transitioning provider's name and office contact information, the encounter diagnoses, the functional status, and the reason for referral. So questions 12 and 13 discuss more in detail that current problem list, the current medication list, and the current medication allergy list in bold towards the top of that screen. So we'll move on to question 12. If there are no other questions, Kristen, are there any questions in the chat box?
No, none have come through yet.
Okay, perfect. Thank you. So for question 12, it's asking what should an EP do if the EP creates a summary of care for a patient that does not have a current problem list, current medication list, or current medication allergy list, because those 3 things are required. So an EP must verify that the required fields for current problem list, current medication list, and current medication allergy list are not blank and include the most recent information known by the EP as of the time of generating the summary of care document, or include a notation of no current problem, medication, and or medication allergies. So keep in mind, even if there is no medication, current problem list, or medication allergies, you still need to put something in that box, so just to say that there is nothing. Okay. For question 13, is an EP allowed to leave one of the items mentioned in question 11 as blank when creating the summary of care record? Yes, apart from the 3 fields that are noted as required for the summary of care record. In circumstances where there is no information available to populate one or more of the fields listed, the EP may leave the fields blank and still meet the objective and its associated measures. Keep in mind, this might occur because the EP does not record such information or because there is no information to record. So you are allowed to leave certain fields blank. However, that current problem list, current medication list, and current medication allergy list must have something in those fields, even if it's to say there is nothing. Okay, moving on to question 14. Must an EP transmit all data pertaining to a patient's laboratory test results in the summary of care document? The answer is no. An EP is not required to transmit all data pertaining to a patient's laboratory test results in the summary of care record. However, an EP must have the ability to transmit all data pertaining to laboratory test results in the summary of care document, but may work with his or her system developer to establish clinically relevant parameters for the most appropriate results for the given transition or referral. An EP who limits the transmission of laboratory test result data in a summary of care document must send the full results upon request, so all lab results as opposed to a subset. The exchange must comply with the privacy and security protocol for electronic PHI under the HIPAA Act. So question 15, what format must an EP use when creating a summary of care record? The answer is while an EP cert must be capable of sending the full consolidated clinical document architecture, which we are referring to as CCDA, summary of care, and an EP must do so upon request. An EP may use any document template within the CCDA HL7 standard for purposes of meeting the health information exchange measures. Moving on to question 16. Can the referring provider count the transition in the numerator if the receiving provider converts the CCDA into a non-electronic format such as PDF or a fax? The answer is yes. If an EP sends a CCDA and the receiving provider converts the CCDA into a PDF or fax or some other format, the sending EP may still count the transition or referral in the numerator because they did send it correctly. If the sending provider converts the file to a format the receiving provider cannot electronically receive and incorporate as a CCDA, the initiating EP may not count the transition in the enumerator. The EP needs to ensure that they send it in the correct format. The initiating EP must send a CCDA document that the receiving provider would be capable of electronically incorporating as a CCDA on the receiving end. Moving on to question 17. When must the transition of care referral occur for it to be included in Objective 7 Measure 1? The answer is that for the transition of care to be included in the numerator, it must be with a summary of care record and must occur within the calendar year in which the PI reporting period occurs. The referring EP must have reasonable certainty of receipt by the receiving provider to count the action towards the measure. An EP must have a confirmation of receipt or that a query of the summary of care record has occurred in order to count the action in the numerator. The numerator includes all transitions of care and referrals in the denominator where a summary of care record was created using CERT and exchanged electronically. A patient had to have been seen by the EP during the PI reporting period to be included in the numerator and the denominator. Please note each transition of care should only be counted once, even if the patient was seen multiple times during the PI reporting period. If there are no questions in the chat box, I'll move on to question 18.
We have not received any questions, but just a reminder to everyone on today's webinar that we will include the FAQs along with today's presentation out to everyone that's participating today, and it will be posted on the Health Current and Access websites.
Thank you, Christine.
Sure.
So question 18 is what changed between modified stage 2 in program year 2018 and stage 3 in program year 2019 for Objective 7 Measure 1? The following changes occurred between those two different stages for Measure 1. First, the measure was formerly Objective 5 in program year 2018 for modified stage 2. It is now Objective 7 Measure 1 for program year 2019 for stage 3. And then the second item that changed is that the threshold increased from 10% to 50%. Question 19 is what documentation must be submitted to demonstrate that the EP meets Objective 7 Measure 1? Keep in mind that this is very similar to supporting documentation for Measure 2 and Measure 3. The EP should submit a CERT-generated dashboard for the selected PI reporting period that shows the following 4 items: the provider's name, the numerator, the denominator, and the measure percentage. Please make sure that the CERT-generated dashboard reflects that provider's name because that numerator and denominator should only be reflected of the patients that were seen by that provider and not, it should not be, that CERT-generated report should not be pulled for the entire practice. In certain situations, a non-CERT-generated report may be necessary. The use of non-CERT-generated reports may be permitted upon access review and approval. Question 20, how is the EP required to incorporate a summary of care document into the CERT to meet Objective 7 Measure 2 numerator? The answer is that Measure 2 does not specify the manner in which EPs are required to incorporate data. CMS does not define the word incorporate for this measure as it may vary among recipient providers based on the provider's HIE workflows, their patient population, and based on the referring provider. The record may be included as an attachment, as a link within the EHR, as imported structured data, or the provider may count a reconciliation of the clinical information within the record to incorporate this information into the patient record within the EHR. However, a record cannot be considered incorporated if it is discarded without the reconciliation of clinical information or if it is stored in a manner that is not accessible for EP use within the EHR. Moving on to question 21, is an EP able to include a transition of care referral in Objective 7 Measure 2 or Measure 3 numerator if the patient refers themselves to the EP? The answer is that there may be circumstances when a patient refers himself or herself to a setting of care without a provider's prior knowledge or intervention. These referrals may be included as a subset of the existing referral framework, and they are an important part of the care coordination loop for which summary of care record exchange is integral. An EP should include these instances in the denominator for the measure if the patient subsequently identifies the provider for whom he or she received care. An EP may count such a referral in the numerator for the measure if he or she undertakes the action required to meet the measure upon disclosure and identification of the provider from whom the patient received care. For question 22, it is what determines if electronic summary of care records are unavailable and should be excluded from Objective 7 Measure 2 denominator. The denominator includes the number of patient encounters during the PR reporting period for which an EP was the receiving party of a transitional referral or has never before encountered the patient, and for which electronic summary of care record is available. For a summary of care record to be unavailable, the EP must meet both of the following. So the first one is that the EP must have requested electronic summary of care record to be sent and did not receive electronic summary of care document. So that's the first item that the EP must meet. And then the EP must meet one of the following criteria in addition to that first one. So the two ones the EP can meet, they can meet either one, they don't have to meet both. So the first option is queried at least one external source via the HIE functionality and did not locate a summary of care for the patient, or the provider does not have access to HIE functionality to support such a query. Okay. Or the EP can meet that they confirm that HIE functionality supporting query for summary of care documents was not operational in the provider's geographic region and not available within the EP's EHR network as of the start of the PR reporting period. So keep in mind that first item that I'm highlighting, that must be met regardless. And then that EP needs to either meet that second to last bullet point that's highlighted currently or the very last one. Okay, so regardless, that first one has to be met each time for them to exclude from the denominator a patient encounter that was transferred. Moving on to question 23, what changed between modified stage 2 and stage 3 for Objective 7 Measure 2? This is a new measure for Program 2019 stage 3, so nothing changed because it was never a requirement in modified stage 2 in Program 2018. Okay. We've got 10 more minutes. If you have any questions, make sure to put them in the chat box. I'm going to go ahead to question 24. What documentation must be submitted to demonstrate that the EP meets Objective 7 Measure 2? The answer is that the EP should submit a CERT-generated dashboard for the selected PR reporting period that shows the following. 4 things: provider name, the numerator, the denominator, and the measure percentage. Keep in mind that in certain situations, a non-CERT-generated report may be necessary. The use of non-CERT-generated reports may be permitted upon access review and approval. And Kristen, were there any questions?
Yes, for question 23, how would you know that we requested an electronic summary of care, and how would that be tracked?
Okay, great question. That's going to be for question 22. So when you're wanting to exclude those, you're going to want to talk with your CERT vendor and discuss with them potentially if that's going to be tracked in your CERT. Because if the CERT vendor is capable of doing that, that might potentially be tracked that way. Another one would be emails in the system. It depends. This really depends on how your CERT works. And so it would have to show for each patient. So say, for example, you talk to your vendor and they are not able to track that in their system, you're going to have to go in and try to find a way to prove that and submit that documentation. So for example, if there's a patient, they're transferred to you, and then you send an email maybe to the original provider saying, can you send me a summary of care record, electronic summary of care records. Make sure you have them send you electronic summary of care record, potentially in the patient portal or in their file. It potentially might show that, and that's something that might vary depending on the CERT. So just make sure to talk to your vendor ahead of time if that's something you need to exclude from the denominator to make sure you meet the minimum threshold. And that's a lot of additional work, so you may not want to go that route if you meet the minimum threshold with that CERT-generated dashboard. And let me know if the person has any follow-up questions on that, or would like to discuss that further. Okay, we'll give you a few minutes. The person that asked that question, and I can scroll back up if I need to. Okay, moving back to question 25. The question is, must all 3 clinical information reconciliations be completed through automation in order to be included in Objective 7, Measure 3 numerator? The answer is no. The clinical information reconciliation process may include both automated and manual reconciliation to allow the receiving EP to work with both electronic data provided with any necessary review and to work directly with the patient to reconcile their health information. Question 26, the question is, must an EP update a patient's clinical information in order to include it in Objective 7, Measure 3 numerator? The answer is no. If an update is not necessary, the process of reconciliation may consist of simply verifying that fact or reviewing a record received on referral and determining that such information is merely duplicative of existing information in the patient record. Again, if y'all want to follow up on my answer, please put something in the comments if you have another question regarding any of these items or Objective 7 in general. Question 27 is asking, the non-medical staff allowed to conduct clinical information reconciliations included in the Objective 7 Measure 3 numerator? Yes. A non-medical staff may conduct reconciliation under the direction of the EP so long as the EP or other credentialed medical staff is responsible and accountable for review of the information and for the assessment of and action of any relevant clinical decision support alert. Moving on to question 28. What changed between modified stage 2 in program year 2018 and stage 3 in program year 2019? For Objective 7, Measure 3, the following changes occurred between the different stages. For Objective 7, Measure 3, the first item that changed was that the measure was formerly Objective 7 in program year 2018 for modified stage 2. It is now Objective 7, Measure 3 in program year 2019 for stage 3. The second item is that the threshold increased from 50% in program year 2018 to 80% in program year 2019. Starting in stage 3, an EP must review a patient's known medication allergies. That was not a requirement for Objective 7 in modified stage 2 in program year 2018. The last bullet point also was not a requirement because starting in stage 3, an EP must review a patient's current and active diagnoses. Moving on to question 29, we have about 5 minutes left in the webinar, so if you have any of those questions, make sure to put them in the chat box. Question 29 is asking what documentation must be submitted to demonstrate that the EP meets Objective 7, Measure 3. The answer is that the EP should submit a CERT-generated dashboard for the selected PI reporting period that shows the following 4 items: the provider's name, the numerator, the denominator, and the measure percentage. Keep in mind that in certain situations, a non-CERT-generated report may be necessary. The use of non-CERT-generated reports may be permitted upon access review and approval. Let's discuss a few questions about the exclusions for this objective. Question 30 is what exclusions are available to an EP for Objective 7, Measure 1? The answer is that an EP may take an exclusion for this measure if the appropriate exclusions listed below apply. And the first one is that an EP transfers a patient to another setting or refers a patient to another provider fewer than 100 times during the PI reporting period. The other option for exclusion, which is actually not applicable to EPs in the state of Arizona, but that is the broadband exclusion. And you can read more about that if you want to. And in the presentation, there was also a link to the CMS tip sheet regarding that broadband availability. But for the sake of time, I'm going to skip over the rest of that question. Question 31, what exclusions are available to an EP for Objective 7, Measure 2? The answer is that an EP may take the exclusion for Objective 7, Measure 2 if the appropriate exclusion listed below applies. That first bullet point talks about the total transitions or referrals received in patient encounters in which the EP has never before encountered the patient is fewer than 100 during the PI reporting period. So again, for Objective 7, Measure 2, if they're receiving less than 100, which the denominator would show, and it needs to be during the PI reporting period, they can take that exclusion. The second bullet point discusses the broadband availability exclusion, which is not applicable for EPs in the state of Arizona. Christine, are there any current questions in the chat box or follow-up questions?
No, not at this time, Priscilla.
Okay, perfect. We'll go over a few more questions in this frequently asked question document before we end the presentation. Question 32, what exclusions are available to an EP for Objective 7, Measure 3? There's only one exclusion available, and the answer is an EP may take an exclusion for Measure 3 if the total transitions or referrals received in patient encounters in which the EP has never before encountered the patient is fewer than 100 during the PI reporting period. Question 33, where do I find the latest information available from the Federal Communications Commission? The answer is if an EP is interested in additional information from the FCC regarding broadband information, the EP can visit the FCC website. Any documentation that might be used by the EP to support meeting the exclusion must be supported by the format 4/1 megabytes per second. And keep in mind that the 4 is and the 1 are referring to the download and the upload speed. So another criteria or baseline for measuring megabytes per second is 25/3. But for this broadband exclusion, if you are going to do further research and going to the FCC website, just make sure you're looking that's supported by that 4/1 megabytes per second. The state recommends that the EP uses the Broadband Access exclusion tip sheet from CMS to determine if the EP is in a county that is eligible for the exclusion. Again, the state of Arizona does not have any counties listed. Question 34, what documentation is required to support the EP meets the appropriate exclusion discussed in questions 30 to 32? The answer is that the following types of documentation would be sufficient. The first one is the CERT dashboard showing the EP had fewer than 100 in that denominator during the PI reporting period for each individual EP. And then there's a second option supporting it, which is to provide supporting documentation other than the CERT dashboard that demonstrates the EP had fewer than 100 qualifying transitions, referrals, or encounters for the appropriate measure. So those are the types of documents to help you meet those exclusions that an EP in the state of Arizona is allowed to claim. That does conclude the rest of the questions. Christine, if there are any last comments or questions in the chat box, I can answer those. Otherwise, we can end the webinar.
I have not received any additional questions through the chat box at this time, so I think we are safe to say that we can conclude today's webinar.
Perfect. And again, everyone, just keep in mind that these documents will be made accessible via Health Current and Access. If you have any questions, the end of the presentation, the PowerPoint does have contact information if you do come across any additional questions.
Thank you so much, Priscilla. Thank you for everyone who registered and participated in today's webinar. As we'll receive a copy of today's FAQs and the slide deck. If you have any follow-up questions, there's contact information contained in the slide deck as well. And the recorded session along with the presentation and FAQs will be posted to the website. Thank you again for participating in today's webinar. Thank you so much, Priscilla, for presenting, and I hope everyone enjoys the rest of their day. Thank you.